Hi, my name is Jasmine Pope. This is my last video for week 6. I'm going to verbalize how to give a suppository for Professor Norma's fundamentals, skills, labs. So first things first, I'm going to wash my hands thoroughly with soap and water, go knock on the door, introduce myself, make sure the patient knows I performed hand hygiene. I would ask the patient to state their name and date of birth. I know that if the suppository is soft, you can hold it under cold water. A lot of times suppositories come out of the refrigerator. So I just make sure that it's at least room temperature so it's comfortable for the patient. I would take over the suppository and make sure that I have on clean gloves, and I would explain to the patient what we're going to do, which is insert the suppository into the rectal area. So I'm going to make sure that I have my gloves on. I'm going to lubricate the tip of the suppository with a lubricant like K-jelly or something like that. I would then make sure that I tell the patient to again lay on their side with their lower leg straightened, and then their upper leg should be it should be bent and forward toward the stomach. I would then lift the buttock to expose the rectal area, and you always want to make sure that you're verbalizing this while touching the patient. Don't just touch them. I would then insert the suppository with the pointy end going into the rectum. I would pass it with my finger until it passes the muscular sphincter of the rectum. So you're going about 1 inch in if it's an adult. From there, you tell the patient, hold the buttocks together for a few seconds, remain laying down for about 5 minutes or so to avoid the suppository from coming out. I would then discard any materials I used. I would wash my hands. I would explain to the patient what could possibly happen, give them their call light, lower the bed, make sure they have fluids, and that's how I would administer a suppository.